In this video, we'll be discussing the process of delivering a baby. We'll also discuss cesarean section as a particular concern. Parturition is a more technical term for the act of giving birth. It involves a complex interplay between the hormones estrogen and oxytocin, prostaglandins, and the myometrium. Remember, the myometrium is the thick, powerful muscular layer that surrounds the uterus. Estrogen levels rise towards the end of pregnancy, and these rising estrogen levels make the myometrium more sensitive to oxytocin. This increased myometrial sensitivity is probably responsible for the false labor some women experience. False labor refers to Braxton Hicks contractions, irregular, sporadic contractions that occur in the last few weeks of pregnancy. Braxton Hicks contractions don't increase in frequency or strength like productive contractions that actually lead to delivery do. The final trigger for delivery is fetal production of oxytocin. This fetal oxytocin triggers release of prostaglandins from the placenta. The oxytocin plus the prostaglandins trigger contractions. Synthetic oxytocin, sold under the brand name Pitocin, is used to induce labor when necessary. This slide shows the positive feedback loop that leads to acceleration of contractions. Oxytocin and prostaglandins make the myometrium more sensitive, stimulating contraction. As contractions occur, the fetus moves, distorting the myometrium. As the myometrium stretches, it produces more prostaglandins, which trigger more contractions, which distort the myometrium even more. You get the idea. This strong positive feedback loop continues, triggering stronger and more frequent contractions until, finally, the baby is expelled. Accelerating contractions move the baby downwards against the cervix, the opening to the uterus. The first stage of labor is called the dilation stage because the cervix is dilating, opening up. This is the stage in which the amniotic sac ruptures, sending the amniotic fluid, which the baby has been floating in for nearly the entire pregnancy, rushing out. Labor then progresses to the expulsion stage. In this stage, the cervix dilates to about 10 centimeters. Contractions are strong, frequent, and long, pushing the baby down and out through the cervix and vagina. After the baby is expelled, contractions continue until the placenta is ejected too. This is sometimes referred to as the afterbirth. I want to switch gears now and talk for just a minute about cesarean section, or C-section. Cesarean section is surgical delivery of a baby. It's usually done with epidural anesthesia. An epidural injection is made into the spine so that the mother is still awake and aware, but numb from the abdomen downwards. In an emergency C-section, general anesthesia may be used, rendering the mother unconscious. Once the mother is anesthetized, a wide incision is made through the abdominal wall, then through the uterus and amniotic sac. The infant is then lifted out of the uterus, and the uterus and abdomen are sewn back up. Like any major surgery, there are major risks associated with C-sections. The baby is a bit more likely to develop breathing problems, but most of the risks are to the mother. With a C-section, she's at greater risk of developing infection, excessive blood loss, damage to the bladder or bowel. She may also develop adhesions, that's scar tissue, that can be painful and can complicate future pregnancies. Women also have a longer recovery after C-section and spend more time in the hospital than they do after vaginal delivery. Last, but certainly not least, there's a higher maternal mortality rate for C-sections than for vaginal deliveries. It's a major surgery and should not be undertaken lightly. Part of the reason I want to discuss C-sections with you is that there's been concern over the last few years about C-sections being performed when not medically necessary. Thankfully, I think there has been increasing awareness among both obstetricians and expectant mothers that C-sections are not risk-free. Now, despite the risks, there are situations when it is important and medically necessary to perform a C-section. This slide lists 4 situations where a C-section is medically necessary. These here on the left relate to abnormal positioning of the baby. Babies in abnormal positions are likelier to get injured during a vaginal delivery. They may experience joint dislocation, and they're more likely to have umbilical cord-related complications. Usually, a baby turns during the final stages of pregnancy so that its head is pressing against the cervix, and it can be delivered head first. If the baby does not turn on its own, there are a variety of techniques to try to get the baby to turn, including massage and stretches. But sometimes these techniques don't work, and the baby is in an abnormal presentation. If the baby is positioned so that it's presenting its back to the cervix, this is called the transverse position. If the baby cannot be turned from this position, it must be delivered surgically. If the baby is presenting either its feet or its butt to the cervix, it's called a breech presentation. Breech babies can be delivered vaginally, but it's risky. With this positioning, the head is the last part of the baby to emerge, and it may be more difficult to guide it through the birth canal. There's also more likely to be compression of the umbilical cord, cutting off the baby's oxygen supply during delivery. The 2 indications for C-section on the right here have to do with the placenta. Placenta abruptio, or placental abruption, is when the placenta becomes detached from the wall of the uterus. This detachment cuts the baby off from its oxygen and nutrient source and may lead to severe bleeding from the mother. Placenta previa is when the placenta is attached low on the uterus and blocks vaginal delivery. In the case of placenta previa, the baby cannot be delivered vaginally without risking damage to the placenta, maternal hemorrhaging, and loss of oxygen to the baby. In some, there are situations where it is medically important for both mother and baby to have a surgical delivery, but still, it's not something that should be done as a matter of course. After studying this video, you should be able to describe the conditions that trigger labor, describe the positive feedback loop that results in delivery, including the role of estrogen, oxytocin, prostaglandins, and the myometrium. Distinguish between the dilation, expulsion, and placental phases of delivery. Describe what a C-section is, and identify the risks associated with a C-section. And last, describe when a C-section may be medically necessary.